Today we're going to talk a little bit about regenerative therapy, what that is, what it means to you, and more importantly, how you can benefit from it. I'm Dr. Hergert with South Lake Physical Medicine. This is Philip Talley, our nurse practitioner, part of our medical team here. So regenerative therapy is cutting edge stuff. I mean, it's stuff that, when we went to school, they weren't talking about. When your primary care went to school, they weren't talking about regenerative therapy. It was kind of a science fiction thought that you could regenerate tissue. We thought you could, but now the science has caught up with, and today you can actually see tissue regeneration and see it recuperate. So instead of steroids that might tear the joint up and accelerate the degenerative process, what do these products do?
So an easy way to think of this is a house fire. So steroids are the fire department that come in and spray water on the house. They put the fire out. Regenerative medicine actually is the construction team that comes in and actually rebuilds the damaged part of the house. So we actually have seen an increase in joint space. So that's like the house being rebuilt. It's the joint space, the tissue that's being rebuilt in there.
So this is a great alternative to joint replacement because if you think about joint replacement, if you replace a shoulder or a hip or a knee, how long is it going to last?
They're hoping 10 years.
Right. And so what happens then when it wears out?
There's usually a revision.
How many revisions will they do?
I think of one. There may be up to
Right.
2 now, but I'm thinking they're still just pushing 1.
So we're in a pretty active, healthy community. The people are, 65, 70 isn't that old.
Right.
We have an 84-year-old competitive wakeboarder.
Yeah.
If these folks get joint replacement when they're 55, and at 65 they got to do another one, what's that look like?
The prognosis doesn't look so great.
No.
So that's one of the reasons why we're so animate about regenerative medicine. If we can delay or stop a replacement,
Sure,
it's much better for everybody.
Let's talk a little bit about the process for the patient. If I'm someone that has knee pain and I want to get this checked out, find out if I'm a candidate, what does that look like?
So after you contact us and we set your appointment up, you come in, we do a good assessment. It may include imaging, it may include reviewing the imaging you've already had, a physical assessment, some medical history, and then a physical assessment and a sit down and discuss options with the patient.
Okay. So we're going to sit down, we're going to review everything that you've had done. We're going to review everything that you're currently doing, and then whatever imaging we need to get so that we know what we're dealing with. And then we're going to set a plan in place for these folks that are a candidate for any type of regenerative procedure. So the day of the procedure, what happens?
Wake up, have your breakfast, come see us. There is no special. You don't have to. It's not anesthetic.
So you don't have to have someone drive you there.
You don't have to have somebody drive you.
Take care of you. Okay.
You drive in. We do the procedure, the injection.
Am I going to miss time from work?
You drive yourself home. You go on about your day.
Okay. So then we follow up shortly thereafter. There'll be rehab. There'll be other things that we add to the plan so that it's a comprehensive plan. Because we don't want to just be the place that people go and get a one-time shot. We want to be the place that sees them through the process to the best outcome possible.
And we've seen that the things that we're adding has actually increased the success rate of our patients.
Sure.
And so, like you said, it's not just an injection and send you out the door. We want to do the things that actually help you feel better. It's not always medication, like it's the rehab. There's a lot of things that we do that we've learned throughout the years of doing this that we've seen that actually benefit the patient.
So let's talk about what most people experience after they have the injection. I can speak personally because I've had procedures done on both wrists and hands. Most people are going to notice some benefit within the first couple of weeks. They're going to say, I think it may be getting a little better. Over time, how would you say people progress with that?
Yeah, so we usually set up an appointment to follow up in 2 weeks. That's kind of where we start to see some improvement, because it is a process, and so we're going to start here and we're going to end up here, and so we progress, and so we want to help you progress the best we can. So usually about 2 weeks after the first injection is when we'll see you, and then we start adding, and so we see progression. There may be a delay where a week or two we don't see improvement, then it progresses some more. And so as the days go on, we see progression, hopefully every week, better than the week before. But for sure, we want the end result to be better than the start.
So if somebody's going to consider doing this, how many months would you say they should give themselves to where they can say, hey, this was a success or this wasn't?
A good 90 days.
Okay.
We want a good 3 months. But there's studies showing that the product could still be working a year after the injection, even though it's been a full year. There's still studies showing out that it could still be making improvements a year out.
Okay, so we don't have our private clinic data on this, but if you were to say people that get the result that they want versus people that don't get the result that they want, how many would you say get the result that they want?
Oh, it's not even close. We're a good at least 90%
are happy. Okay, so that's what I like to measure. We'll do clinical studies later, but I like 90% happiness.
It's not based on who ran a marathon. It's based on pain reduction,
sure,
happiness,
okay,
patient improvement.
So we've literally done thousands of these procedures. Like we said before, incredibly high success rate. A lot of folks will tell their story. Some people don't tell their story, but most people tell their story because you don't know how bad you're suffering until that's gone. If that knee is keeping you up at night, driving you crazy, and all of a sudden after 3 months that's gone, you're pretty much going to tell everybody in the world what's going on, right?
Yeah, and we've had people in the lobby come in for their appointment, and somebody that's doing their follow-up is walking out and just going on and on about how great it is and how they should do it.
Right. So one patient comes to mind, and that's a guy that, we saw him, probably close to 3.5 years ago. He's got a video testimonial on our website. His name's Hal. He came back 2 years later, saved for it, came back and did the procedure, and his story is that literally when he walked in to do the first consultation, was using a cane, barely able to walk, and now he's walking a couple, 2 or 3 miles a day for exercise.
Uninterrupted by pain.
Right. Living his life again. So check out his testimonial. It's pretty powerful. And like he said, it was as simple as just deciding he was going to do it. So you've heard that it changes lives. What did every one of these people have to do? They had to take that first step. And I promise we will make that as easy on you as possible. It's as simple as you call our number and set up your consultation. There's no obligation. There's no strings attached. Just come in and sit down and have a conversation and find out if this is something that might be right for you. Come see us.